Hi there, my name is Emily DeHart, and I will be attempting to give a short lecture about some of the physiological aspects of lactation and breastfeeding. The multiple stages of breast development are influenced by various physiologic changes that are crucial to be able to breastfeed successfully. But in order to understand this fully, we need to understand the stages of breastfeeding and their individual functions. There are 3 different stages the breasts go through to be able to breastfeed successfully. These include mammogenesis, lactogenesis, and lactation. Mammogenesis occurs during puberty and is the stage where the mammary glands develop. During and immediately after pregnancy, lactogenesis occurs. This is when the alveolar cells in the mammary glands mature, giving a mother the ability to produce breast milk. Postpartum, after mother gives birth to her baby, lactation occurs. This is the process of actively producing milk. Our goal is to discuss the physiological aspect of breastfeeding, so we'll jump right in with the lactogenesis stage. Beginning in the second half of pregnancy, the placenta begins to supply high levels of progesterone, which is around the same time some mothers begin to produce the early milk, or colostrum. After a mother gives birth to her baby, and shortly after the placenta, the body has a rapid decrease in progesterone and elevated levels of prolactin, which is the hormone that triggers breast milk production, as well as cortisol and insulin, all of which result in the production of breast milk. Within a few days, a mother's mature milk will come in, the process known as lactation, and will continue to do so as a result of a supply and demand. Maintaining lactation requires consistent removal of milk and stimulation of the nipple. In doing so, prolactin is released from the anterior pituitary gland, and oxytocin is released from the posterior pituitary gland. Prolactin and oxytocin act independently of one another, but they're both needed for breastfeeding to occur successfully. Like I mentioned before, prolactin is the milk-producing hormone. It stimulates the growth of milk ducts within the mammary glands, the reproduction of epithelial cells, and it also aids in milk protein synthesis. When the baby sucks on the mother's nipple, resulting in the stimulation of the nerve endings within those tissues, the concentration of prolactin is increased rapidly, resulting in successful breast milk production. Oxytocin, on the other hand, is important for milk ejection and letdowns. Not only is it a hormone, but it's also considered a neurotransmitter. The stimulation of the nipple causes afferent signals to travel to the hypothalamus in the brain via the spinothalamic nerve, where oxytocin is then released. However, other outside stimuli can cause this reaction as well, such as a baby crying or even a visual cue that a baby is hungry. Oxytocin causes constriction of cells within the mammary glands that move milk into the ducts and eventually out of the nipple and into the baby. Of course, most people know oxytocin as the feel-good hormone, or the hormone that makes people feel calm and at ease, which is why the bonding and skin-to-skin stage, also known as the golden hour, shortly after birth is so crucial. Not to mention why stress, or anything that can cause a significant decrease in oxytocin, can affect breast milk production, also known as breast milk supply. To recap, there are 3 stages to breast maturity, but lactogenesis and lactation are important for breast milk production. After a baby is born, the birthing of the placenta triggers a rapid drop of the progesterone hormone and a significant increase in the milk-producing hormone, prolactin. Prolactin works in conjunction with oxytocin to produce and supply breast milk from the mother to the baby. When a baby latches onto the mother to stimulate her nipple, it sends an afferent signal to the hypothalamus in her brain, and the efferent signal is then sent to the nipple, constricting the mammary glands, providing the milk ejection reflex for baby to nurse. Because oxytocin is also known as the feel-good hormone, it can result in a calm, connected, and relaxed neurological state while mother breastfeeds. This can also result in a calm and relaxing state for the baby, which is why some people joke that breastfeeding is like duct tape, it can fix everything. When the opposite occurs, or during times of stress, or whenever there is a significant decrease in oxytocin, a mother's breast milk supply could be hindered. Successful breastfeeding cannot occur without both prolactin and oxytocin working hand in hand. Thank you.